Good afternoon. It's 4 o'clock and I'm Scott Manaker. I'm a pulmonary physician at the University of Pennsylvania and Penn Medicine, and I'm here this afternoon to talk about pulmonary hypertension and the new ICD10 diagnosis codes for pulmonary hypertension. I know this is a live session, and hopefully we've got some folks who are going to be typing in questions. While they're listening and thinking and potentially sending in their questions, let me tell you a little bit about myself. I'm a pulmonary and critical care physician at the University of Pennsylvania, as I mentioned. I see lots of patients in both the inpatient and outpatient setting, and I also do a lot of administrative work related to the diagnosis, coding, billing, and reimbursement of physicians for the services that they provide to patients, including patients with pulmonary hypertension. One of the fun things that I get to do is go to CMS headquarters outside of Baltimore and meet with the National ICD10 Coordination and Maintenance Committee and recommend for changes in diagnosis codes on behalf of the pulmonary and critical care community. One of those successful interactions several years ago was expanding the available ICD-10 codes to describe the range and types of pulmonary hypertension that many patients have in a much more discrete and clear manner that much more closely aligns with the World Health Organization classification that's been around for more than 10 to 15 years. The new diagnosis codes describe the range of types of pulmonary hypertension that patients have, and doctors and patients should be aware of these new diagnosis codes. Why should they be interested in these new diagnosis codes? Why is it important for them to know about these diagnosis codes? Let me just see, we may have a question coming in here. Okay. The new diagnosis codes are important for several reasons. Number one, they can potentially vastly improve the type of research that physicians and investigators can perform. First of all, they can identify appropriate populations of patients with specific types of pulmonary hypertension, targeting individuals with just the right type of pulmonary hypertension, be it class 2 pulmonary hypertension, class 1 primary pulmonary hypertension, or other forms of pulmonary hypertension. Another important aspect of the research that can be done with better diagnosis codes is analyzing claims data and data from electronic health records by diagnosis. Again, trying to answer important questions with very specific types of patients that have different forms of pulmonary hypertension that should be really important. Now, when patients go and see their doctors, it's very reasonable for patients to go and ask, "Doctor, what kind of pulmonary hypertension do I have? And are you listing my diagnosis correctly?" It's important not only for the research, but also therapies. Probably the most important example would be CTEPH, or CTEPH, chronic thromboembolic pulmonary hypertension. There's a very specific ICD-10 diagnosis code. It's I27.24. And for patients with that specific form of pulmonary hypertension, there are specific therapies, including specific drugs for that form of pulmonary hypertension, as well as procedural interventions, including surgery for that type of pulmonary hypertension. As time goes on, research moves forward, and we develop other therapies for specific types and subtypes of pulmonary hypertension, making sure that you have the right specific ICD-10 diagnosis code associated with your chart and your diagnoses and your health insurance claims, will help researchers find you, researchers study you, and researchers and investigators identify you for entry into clinical trials and eligibility for new and developing therapies. Many patients are curious about getting the information for how can they find out about their particular diagnosis code, particularly if their doctor may not know. Well, there's a wonderful article coming out in the journal Chest, which is the publication of the American College of Chest Physicians. It's authored by a specialist in pulmonary hypertension, Stephen Mathey, who's a physician at Johns Hopkins, and a colleague, Sharon Matthew, at the University of Pennsylvania. It's available online on the website for Chest, and it will be coming out in print in the next several months. It has a wonderful table that matches up the World Health classification of pulmonary hypertension into the 5 classes, along with the old, relatively non-specific ICD10 diagnoses that were retired back on October 1st, 2015, and how the World Health Organization classification system and the old ICD-9 diagnoses now match up with the new ICD-10 diagnoses. So it's a terrific resource, this table in their paper, for both physicians and patients to look up what kind of pulmonary hypertension they have and what should the right diagnosis code be. And again, as I mentioned before, having that right diagnosis code allows you to be included in specific research studies and investigations for your particular type of pulmonary hypertension. And then as new therapies come out, it makes it much easier for people to find you. In the context of an electronic health record for a small practice or a large health system, they can simply run a query and get a whole list of patients with your specific type of pulmonary hypertension that has a new therapy available. Another potential great advantage to having the correct specific diagnosis codes is it will give you better access to specific therapies. So for example, many insurance companies and many pharmacies will have discounted prices or lower co-pays for patients with certain diseases for certain types of medications, including very expensive medications. Now, I've been talking very heavily about issues here in the United States. But remember, these diagnosis codes are aligned with the World Health Organization. So for those listeners who might be in Europe, Asia, Africa, far-reaching parts of the globe, these diagnosis codes are equally as available to you as they are here in the United States. It makes it very easy for investigators worldwide to include you in their research, consider you in their research, and find you and identify you for either clinical trials or alternatively new therapies when they come out and are appropriate for your type of pulmonary hypertension. One of the good ways to ask your doctor or even investigate yourself what your diagnosis codes are is simply using your electronic portal. Most electronic health records, most practices, most large institutions who have electronic health records have the option of a patient portal. And using that patient portal, much the same way you're listening to this live stream today, gives you access to your health record. Depending on how the portal is configured, you can see your appointments, you can see your medications, you can see your diagnoses, and it gives you an opportunity to ensure that you have the correct diagnoses, or alternatively, to have a conversation with your physician and other treating providers, which might include pharmacists, nurse practitioners, physician's assistants, and a variety of individuals, to make sure that they can update and give you the most appropriate, most specific diagnosis codes. Now, how important is research on pulmonary hypertension? Everyone's going to have their own personal opinion about this, but I would say it's critically important. Pulmonary hypertension has been around for a long time. It shows up in many different forms for very different populations of people. One of the real difficulties in trying to advance research has been rapidly, easily identifying appropriate subsets of patients with pulmonary hypertension. To the extent your type of pulmonary hypertension has the correct diagnosis codes associated with it, you will be more likely to be included in research, considered with research, and be eligible for new therapies as they are coming out. Many of you with specific forms of pulmonary hypertension may not find your form of pulmonary hypertension in the currently available codes. There are now an increasing number of genetic disorders that are believed to be fundamentally important and the cause of pulmonary hypertension. There's not a specific code for each of those genetic disorders, but it's recognized that's an opportunity for us to improve the coding system to find patients with one specific genetic form of pulmonary hypertension as distinct from other forms of pulmonary hypertension. A second area that needs to be improved is the area of cardiac structural abnormalities causing pulmonary hypertension. And many cardiologists, as well as pulmonary physicians and other types of physicians who specialize in pulmonary hypertension, are having active discussions about how to improve the coding system for patients with structural heart disease and associated pulmonary hypertension. So how can we go and improve the currently existing diagnosis codes? How can we go and expand the available diagnosis codes? As I mentioned, that committee that meets at CMS headquarters twice a year is always open and willing to hear new recommendations and new requests to expand the codes. Patients can certainly talk to their physicians and emphasize the importance, and then physicians can speak to their specialty societies, whether it's the Pulmonary Hypertension Society, the Society of Thoracic Surgeons, the American Thoracic Society, the American College of Chest Physicians, and many other organizations who collaborate, who coordinate, and who join in a coalition to make appeals to the ICD10 Maintenance and Coordination Committee to get new ICD-10 codes out there. Individuals and their treating physicians and providers who are dedicated to getting some new and expanded ICD-10 codes have to be patient because there's a very long timeline. Following a meeting where the committee considers requests for expanded ICD-10 diagnoses, they then have to go through a public rulemaking process where in the spring or early summer they publish a rule with proposed changes to the coding system. Over the course of the summer is a public comment period where individuals, societies, and all interested parties can then send letters into the committee asking and requesting changes in support or sometimes opposing what the committee has proposed to do, and then the committee issues a final rule in the fall of that year. Yet, in the next year is a period of time for education, followed by implementation in October. So there's about a 2-year timeline from an initial presentation to the ICD-10 committee until new and approved ICD-10 codes, potentially for genetic forms of pulmonary hypertension or for new specifications of structural heart disease associated with pulmonary hypertension. It's a 2-year timeline for us to get those new diagnosis codes out and in use in our records to identify the right individuals with the right type of pulmonary hypertension, both for research endeavors as well as clinical investigations and potential new therapies. Now, getting back to the American healthcare market, one of the important challenges facing individuals is the cost of their medications, the cost of their therapies, the cost of their insurance. Well, having the right ICD-10 diagnosis code for your type of pulmonary hypertension help in terms of getting appropriate insurance coverage, insurance costs, and co-pays and deductibles and payments associated with your insurance? And the answer is yes. Once again, the best example is going to be chronic thromboembolic pulmonary hypertension. There are very specific medications available. They often have associated high costs, and many insurers and many pharmacies may not be able to provide those with a reasonable copay or reasonable coinsurance unless the specific appropriate diagnosis codes are used. I'm looking at another quick question here. So a question has just come in about awareness, not just for patients, but also for physicians and providers. Well, absolutely, it's important that physicians, nurses, pharmacists, and others participating in the care of pulmonary hypertension know and are aware of these new diagnosis codes. As I was mentioning just a moment ago, it's important that prescribers, whether they're advanced practitioners or physicians, often have to have the correct ICD10 diagnosis codes in order to get appropriate payments. Not appropriate payments, appropriate discounts, coinsurances, and copays for prescription medications. Another question just came in, what's next in the pipeline for treatments or new types of research studies? Well, of course, many novel ideas and novel developments are protected by the individuals trying to develop them. But I am aware that, in fact, there are a variety of medications that are in development by several different companies right now for specific forms of pulmonary hypertension. And once again, having the right diagnosis codes will make it easier to identify individuals for those specific clinical trials.